I think the most challenging part is the to elude compliance, at least for people with kidney disease, is mostly education. Because when people have kidney disease from stage 1 to stage 4, unless they have significant protein in the urine, they really don't have any symptoms. So most of the time, it's to convince them that they actually have a problem, that they need to actually see us.
Oh, okay.
That's the biggest problem. Sometimes they are like, I'm peeing perfectly fine. I feel
Yeah.
perfectly fine. I don't know why I need to come and see you. Why do I need to
Yeah.
take these medications? No, I feel fine. And sometimes medication could cause side effects. You have to
Mm.
actually convince them this medicine is actually helping them rather than getting them worse. You know what I mean? So that's the hardest part, typically, just to convince them they actually have a problem and they actually have to
Oh,
take
okay.
medications.
What's good, YouTube? Today we have a very special guest. His name is Dr. Memon, and he's a nephrologist. We will be discussing his journey and how he became a nephrologist and what he does on a daily basis. It's going to be exciting, so stay tuned. Welcome, Dr. Memon. How are you today?
I'm doing good. How are you?
I'm good. So, how about let's start with you introducing yourself?
Well, my name is Amir Memon. I'm a nephrologist. I was born in 75, so I'm like 48 now. Married with 4 kids, working as a nephrologist in private practice with the group practice, um, and working in the Chicagoland area and the suburbs in the Elgin area. Been in practice since about 2009. Did my residency and fellowship both in Michigan, I did my residency in internal medicine, did my fellowship in also in Michigan, and transplant fellowship over there as well.
Mm-hmm. So, how about can you tell us a bit about your background and how you got into the medical field?
Well, I had one brother. My dad was a physician. Um, he was um, he was a graduate from Dow Medical College, which I was as well. And we were in Saudi Arabia for a long time, so I was under his shade all the time. I was also always wanted to be a doctor back home whenever because he was the one most educated in our community.
Yeah.
Whenever he used to go back home, everybody used to call him doctor. I had a high respect for him, so I always wanted to be a doctor from the beginning. Um, so basically, in his shadow, I just went and came here for high school, went back and then got into medical school in Pakistan, and then finished my
Oh, okay.
medical over there. Yeah. So that was my inspiration.
And how did you get into nephrology?
But that's a long story. I think initially I didn't like nephrology at all. It was very complex. But then during my residency, one of the nephrologists over there was very impressive. Used to know all the answers to all the questions that I used to have. So
Yeah.
that's basically what impressed me the most. That's why I went into nephrology.
Okay. Okay. So, can you describe what nephrology is and what you do?
Nephrology, essentially, as a nephrologist, you practice and take care of patients with kidney problems. Not only just kidney problems, they have problems with blood pressure. Some people have electrolyte problems, so you take care of them. We also take care of some other rare hematological disorders by doing plasmapheresis on some people because it's a similar concept to dialysis. But basically, it's mostly to take care of patients with either kidney or electrolyte problems.
Oh, okay. Okay. So, what do you see the most common in kidney problems with patients?
Well, there's an incidence of hypertension and diabetes that's very prevalent. So that leads to eventually kidney disease if you don't take care of it. And that's the most problem with the kidney disease. That there's a problem with blood pressure and diabetes.
Hmm.
People suffer from kidney disease and they require either dialysis or not dialysis and have kidney disease. So take care of them.
Okay. So what is dialysis?
Essentially, when your kidneys fail eventually, when your kidneys going to, there are different stages of kidney disease. When you get to like stage 5, when your kidneys are not working and your kidney function is less than 15%, essentially that can lead to a lot of complications. A lot of toxins build up in your body, then they can cause a lot of symptoms and have other problems. Other organs will fail. So dialysis essentially does the work of the kidney. So it basically compensates for the kidney failure and essentially cleans your blood. There are different types of dialysis, like the peritoneal dialysis. That's the one way that you can actually compensate and take care of yourself when you have it.
So since we're talking about kidney problems, what would you say? How would we prevent kidney problems?
So mostly, if people who have like causes of kidney disease, So for example, if you're diabetic, taking care of your diabetes, controlling your diabetes will be the number one thing. Diabetic people can certainly have high blood pressure, and people inherently can have high blood pressure too. High blood pressure can also cause kidney disease. So these are the most common reasons. There are other rare disorders like polycystic kidney disease. People can have other autoimmune disease that can cause kidney disease, which are rare. But whenever you have those, essentially just taking medication, taking care of that problem.
Yeah.
Mostly preventative care in people who don't take care of their blood pressure. That's what causes advanced kidney disease.
Okay. Okay. So how about let's move towards the job side of your profession. So how does a normal work day look for you?
So we have essentially a few things that we need to do task-wise. So in essence, we have hospital rounds, and we also have our own clinics. So in a mixture of things, when we have a setting, at least my half day is in the hospital, where I go to the hospital and take care of, as a consultant physician, we're consulted to see people with kidney disease, electrolyte problems. So essentially see them, take care of them. That's half of the day. And other half of the day, you go to your clinic where you have patients that come in, you see them and then take care of them. Besides that, you also have dialysis rounds where you go to different dialysis units and see patients over there. So essentially, there are some days that you don't have any clinics, and we just go to the dialysis clinics and see the patients over there who are getting dialysis in a dialysis machine. So those are three essential things that we do. Besides that, sometimes nursing home. I'm also involved in like research, so sometimes you have to get involved in research.
Mhm.
I'm also involved in administration work. I'm the chair of the medical staff in the hospital. So sometimes you have to take care of that. But job-wise, it's just the three essential duties.
Okay. So how is the workload? Is it
Well,
very
it depends on how much
stressful?
you put on your. It depends on how much you put on yourself. Sometimes some days can be really busy because you have hospital rounds and there's some days that you have only a few consults that you have to see, but some days the consult load is high, so it could be a long day. You have to start early, and then sometimes you have to go back to the hospital, see some urgent patients. Sometimes the clinic can be very long because patients take a very long time
Yeah.
to explain. So sometimes the clinic can be very long. Sometimes the hospital rounds can be very long. Days, typically I put a lot of stuff in the day itself. So there's a lot of things to be done during the day. So I'm usually busy from like the morning to the evening. And sometimes it always days go long, it gets even longer.
Oh, okay, okay. So do you work every day of the week, or do you take extra days off?
No, I work every day. In our group practice, we have about 6 weeks of vacation. So basically, we have about 30 weekdays that we take as a vacation. But weekend, I think right now we're doing every third weekend. So pretty much work all 5 weekdays, and then every third weekend. And vacation wise, we have 30 weekdays that we have off.
Okay, okay, okay. That's good. Okay. So can you describe a particular moment with any of your patients that felt really rewarding or satisfying?
I mean, there are a lot of rewarding experiences in the sense that majority of time when people who have acute kidney injury, which basically the kidney function acutely gets worse, and their kidney function improves later on, and they, let's say, require dialysis, and when they improve, that's one of the most satisfying part. People who suffer from kidney disease who are on dialysis eventually will get a transplant. So there are lots of incidents. A lot of my patients who've been suffering from kidney disease who had been on dialysis, and they eventually get a transplant. So that's like a joyous moment. I remember that we had one patient who had kidney disease. It was an elderly patient. Eventually got to a point that he dialysis, was on the verge of crying, and then verge of like deciding not to do dialysis, deciding to think maybe ending her life and things like that. And I kind of convinced her, well, this is just going to be temporary. And essentially, initially, did not seem that she was going to improve, but that I kept faith, and I kept encouraging her, everything will get better. And eventually, she did get better, and then got off dialysis.
Yeah.
So that was a joyous moment itself. They were happy tears and things like that.
Yeah. 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 Yeah.
But there was one of our patients who actually had a bone marrow transplant. After the bone marrow transplant, she got onto dialysis, and her kidneys had failed. And she was initially on hemo. She was having a lot of symptoms during hemo. Got switched over to what we call peritoneal dialysis, which was more gentle on her. And every month I saw her, it's been about like I think 6 months on dialysis per se, which is very rare to
Oh
potentially
wow.
get off dialysis. And then eventually we saw that her kidney function was starting to improve. And she couldn't believe it, and I couldn't believe it. Eventually got to a point that after 3 or 4 months, or more later on PD, we were able to wean her off the PD. And then this is now what, year 3, and she hasn't required any dialysis. So every time she comes in, she always like cries joys of tears
Yeah.
and everything else. She was actually a special case from university. They actually made it a newspaper and everything else. So she was a survivor of what they call the CML too. So
Yeah.
yeah,
That's cool.
yeah.
You said she was on PD. What is PD again?
So there are two different types of dialysis. One called hemodialysis. One is done through the blood, where you clean your blood directly. One called peritoneal dialysis, when you use your own membranes in your belly to kind of use dialysis. So essentially, we use your own body to clean your blood. So the way it works is basically we put clean fluid in your peritoneal cavity. Peritoneal cavity is in your belly. That's the sac that covers all your organs. So
Oh,
if you
okay.
put a catheter in your belly, in your peritoneum, you can essentially put clean fluid without any toxins. And what the body does is unique in a sense that body equalizes all the toxins everywhere. So like if any part of your body has a cavity, the toxins will go in there too, because all the toxins in your body are equally distributed.
Yeah.
So essentially, if you put clean fluid, the body would essentially put toxins in there, and then you drain it out, and you put new fluid in. So essentially, the idea is that to put clean fluid in, and then the toxin fills up, and you take it out. So essentially, you use your own body as a membrane, and then
Yeah.
you use
Okay.
that as a toxin. So people on peritoneal dialysis, there are two different types. One is called nocturnal. They have a catheter in their belly, and the machine puts all the fluid in and drains the fluid out, puts the fluid in,
Yeah.
drains it out. So that happens overnight, and then in the morning you just uncap it and you're okay. The other
Oh.
ones are usually called manual dialysis, where you put fluid in, leave it in for like 3 4 hours, and then drain it out after that. You do it like
Oh.
3 or 4 times a day.
Okay. Okay. Yeah. That's very interesting. I've never heard of that. So for patients other than dialysis treatment, what other treatments do you guys give?
So essentially, it depends on what the cause of the kidney disease is. Dialysis is only offered when you get to stage 5, when your kidney function is less than 15%. That's when you
Mm,
need like dialysis. Now, even if you're less than 15%, you can go down to like that's like 10 or 4%. But if you're doing okay, you don't necessarily need dialysis. Besides dialysis, when you're in stage 1, 2, and 3, and 4, we essentially treat the cause of kidney disease. So, like for example, if you have diabetic kidney disease, we give you medication that can control your blood pressure. We can give you medication that can control the amount of protein that you have in your urine. Remember,
mm,
the kidneys does the job of filtering the blood. So one of the
yeah.
problems is when you have kidney disease, you can start leaking some protein in your urine. So a
Oh.
lot of medications that we give are essentially to treat that protein in the urine. Essentially, it is a blood pressure medications or other medications, diuretics, and then essentially we give you also other medication to treat other complications of kidney disease. Like for
Yeah.
example, you can have anemia from kidney disease, you can have bone disorders from kidney disease, you can have acid buildup in the body from kidney disease, uric acid can build up
Oh.
in the kidney disease. So we
Oh
essentially
wow.
treat you for all that.
Okay. Okay. So how do you collaborate with other medical professionals to help a patient?
Yeah, so like a lot of problems that our patients have congruent like cardiology problems. They have endocrine problems. So we have to coordinate with their medical doctors. You have to coordinate with their endocrinologists and also cardiologists. So like for example, if a person who has kidney disease, the cardiologist is giving them diuretics because they have also congestive heart failure. So if they give him two medications and essentially get you too dehydrated, then we'll have to cut
Oh.
down the diuretics. So essentially, then we call the cardiologist. Hey, I think this person is a little bit on a dehydrated side. Is it okay if I cut down the diuretics? Also, some other cardiologists put them on blood pressure medications. Sometimes they can be hard on the kidneys. So essentially, we have to communicate with them and say, oh, hey, look, can we try this other medication instead of this particular medications? So a lot of coordination is that we manage co-manage the patients together with other physicians, and communication is the key because
Yeah.
patient get mixed messages. Like for example, if somebody has kidney disease, they get told by one doctor you need to do this, another doctor says something different,
Yeah.
and then they get confused. So
Yeah.
communication.
So what would you say is the most challenging aspect of your profession?
I think the most challenging part is the to elude compliance, at least for people with kidney disease, is mostly education. because when people have kidney disease from stage 1 to stage 4, unless they have significant protein in the urine, they really don't have any symptoms. So most of the time, it's to convince them that they actually have a problem, that they need to actually see us.
Oh, okay.
That's the biggest problem. Sometimes they like, I'm peeing perfectly fine. I feel
Yeah.
perfectly fine. I don't know why I need to come and see you. Why do I need
Yeah.
to take medications? No, I feel fine. And sometimes medication could cause side effects. You have
Mm.
to actually convince them this medicine is actually helping them rather than getting them worse. You know what I mean? So that's the hardest part, typically, just to convince them they actually have a problem and they actually have
Oh,
to take
okay.
medications.
So in stage 5, what symptoms do you see?
For stage 5, they have significant symptoms. Like, for example, they can have appetite problems, they can have nausea, GI problems, they can have itching, they can have apathy, tiredness, fatigue, no
Oh,
appetite,
okay.
losing weight. So that's pretty obvious when you get to stage 5 and you have a lot of these symptoms.
Mm-hmm.
Um, Sometimes people who have advanced kidney disease that progress slowly, they adapt to it too. So like people will be losing weight, be like, no, 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 I'm just not eating that well. Why are you not eating well? Well, I don't really feel like eating.
Yeah.
And then these subtle symptoms can happen. One of our patients, I always give the story that in the university when I started my fellowship, one of the patients who was stage 5 for about a year or 2 years,
Oh.
eventually came back to the clinic. Hey, I need to start dialysis. Like, what happened? It's like I couldn't find my way home. I was just lost in my neighborhood. I couldn't find my way home. They were just very
Oh.
confused. Simple things like that.
Oh, okay,
You can
okay,
get
okay.
confused. You can have itching. A lot of the symptoms.
Okay, okay. By what do you mean by itching? Like excessive itching?
Yeah, in your body you can have excessive amount of itching.
Oh, okay, okay.
You don't have any lesions per se. It's just that because of some of the toxins in your body, the uremic toxins and the calcium and phosphorus being elevated, that can actually cause you to have systemic itching. So you just feel like itching your body everywhere, even though there's no lesions in your
Oh, okay.
body.
So in the next 5 to 10 years, how do you think what changes do you see in your field of medicine?
Well, the field of dialysis is improving every day. So there are improvement in dialysis and dialysis machines every day. Um, Besides that, there are treatment options, like for example, for people who have diabetic kidney disease. 10, 15 years or 20 years ago, we had a different blood pressure medication that came around that was helping people who had protein in the urine. So for many years, that's the only medication we had to treat kidney disease for people who are diabetic kidney disease. Now there are like 2 or 3 more that we can actually give
Okay, okay.
for protein in the urine. So there are new medications and newer research coming out. My key interest is mostly transplant, and transplant field is very open still right now, in the sense that there's a lot of discrepancy of how one center treats you compared to other center. They try to standardize it as much as possible, and newer approaches are coming around to see if they can get transplant last longer as much as possible.
Oh, okay, okay. And is there any research that's happening in the field of nephrology, and how do you keep up with that and dial it into your treatment with patients?
Well, research is ongoing for all the different types of kidney disease, like IgA nephropathy, autoimmune disease. What happens is typically if one particular research comes around, you look into and the neuro medications that come around, you look into the research of the neuro study, and most of the time, whenever the new medications come around, there are lots of talks that you can get yourself updated with. Your colleagues can update you at the same time too.
Yeah.
So essentially, you update yourself from that. Um, Besides that, there are different society year-round conferences that you can attend, and even if you don't
Okay.
attend, there are different subscriptions of different magazines that you can get yourself updated with. In our practice, typically the way I update myself is mostly through, just having different nephrology journals and different nephrology websites that you can routinely go into to tap into neuro research. Um, and then they
Oh,
usually
okay.
gives you an idea about what the new things are. Um, we are part of a corporate itself. The corporate itself has different links. Different things come around. They usually offer different resources as far as lectures, conferences that you can go to and attend, or even online Zoom and everything else that you can attend. So I typically
Oh,
attend
wow.
those, and that basically does.
Oh, okay. That's great. Okay, so what would you say, what advice would you give to high schoolers and college students who are trying to get into the medical field?
Lots of time people look into different things as far as oh, I want to be a doctor and things like that. Sometimes people feel it as a calling. Some people do it as because other people tell them, or
Mhm.
I guess it's more of a glamour or different things.
Mhm.
Nephrology itself is not very rewarding in a sense that you have to do a lot of legwork, a lot of going around. So unless you're passionate in doing it, and so then your job satisfaction will somewhat go down. So I was to advise any people who are in high school or college to shadow somebody and maybe to see how the workload is going. And even
Yeah.
if nephrology, there are different types of nephrologists too. Like for example, there are some who work from the university, so their job load may not be as much. They may be involved in more research and not a lot of patient care directly. In private practice, it's all about patient care. It's all about reimbursements and
Yeah.
about how to take care of patients. And I guess it all depends on what kind of group you join and what kind of practice you like to learn. So my
Mm.
advice would be to first find out if you want to do something like that.
Yeah.
If you want to do more of a procedure,
Yeah.
I see a lot of people who are doing nephrology have joined nephrology for the sake of nephrology and not really like nephrology that much. So
Mm.
their interest is very different. They wouldn't be passionately checking for different rare disorders. Like what some of my partners would per se, they would just do their job. Essential work is done. Treat the common things first. But if
Yeah.
you're really interested in different things, you try to pursue different things.
Yeah.
Some of my colleagues, they just strictly just stick on nephrology part only. They
Mhm.
don't venture on to take care of other things. Um, I have a different habit that I try to get involved in all different things that take care of the patient as
Yeah.
much as possible.
Yeah.
So it all depends on how enthusiastic are you,
Yeah. Yeah.
looking forward to. I still look at my even in the days of vacation and everything else. If one of my patient gets sick, then I look up their labs and everything else because I'm interested in everything.
Mhm.
But some
Yeah.
people don't care. They just get their work
Yeah.
done.
Yeah.
So
Yeah.
I think the main thing I think if you want to be a good doctor, you need to know if you really want to be a physician first of all, and if you want to go into nephrology, you will find out when you do residency something that irks your interest as much as possible.
Mhm.
Nephrology
Yeah.
is a very intellectual field, so I guess if you
Yeah.
intellectually like to do puzzle solving and things like that, then
Mhm.
that's what you want to get into.
Yeah. Yeah, I definitely agree. Yeah. I think any good doctor should really care about their patients. Um, I think that's about it. Thank you for being on my podcast. I really appreciate it. I hope you guys learned a lot from this video. Please comment down what other professions you want me to bring on my YouTube channel. Also, like and subscribe and share the video. Thank you, and bye-bye.